Hi, I'm Brad Hanson. I grew up in the Twin Cities area of Minneapolis, St. Paul, and I moved down to the Texas area and have been here ever since. Started my myeloma journey as an actual MGUS person. And my current diagnosis is that of a high-risk smoldering myeloma. Looking to start treatment sometime this year, according to the health professionals. I think one of the more important things to understand is that the first portion of this diagnosis, only about 5% of the population have MGUS. And to get there, my primary care physician, who I affectionately call my old lady because in my mid to late 50s, he was saying, hey, well, go do a heart scan. Oh, do this, do this. And so he noticed that my kidney function was starting to change, and that also we were starting to see my hemoglobin going down. Now, as a type 2 diabetic, I'm fully aware of hemoglobin A1C, but I hadn't really thought much about the rest, red blood cell and hemoglobin and all of those. So we started to go down, and he noticed that it was getting dangerously low. And I say dangerously low, it was lower than normal. So he started to say, well, why is that? And from that standpoint, we started to go through the process of, well, let's do a colonoscopy. Let's do an endoscopy. Let's find out if you're bleeding somewhere. And he went through this and did the watchful waiting. And essentially, I had no feelings, no abnormal feelings. I wasn't feeling any nauseousness or dizziness. I was, just kind of surprised that that was the case. And so we started to do all of those things. And he finally says, well, I've done everything I can think of. I guess we'll send you to check with a rheumatologist. And I thought, okay, having a compromised immune system, I guess that could be a possibility. So I remember going in after the blood work to the rheumatologist, and the rheumatologist looked at me and said, why are you here? Because I'm coming for this appointment. And the person said, you have no reason to be here. There's nothing, all of the markers, you have no rheumatological issues. Okay, thank you very much. It was one of the shorter appointments I've ever had in my life. And so I reported that back to my primary care, and he says, well, you only have one more option. And so I was off to the hematologist. And in the process of the hematologist, you have to go through normal blood work. Then you have to do your imaging because they wanted to do a full skeletal survey. And so, you're going through all of those things. And I remember showing up at the hematologist oncologist's office, and it's, your typical doctor's office. It wasn't anything scary. Yeah, there were some people that looked like they were having a bad day just because they were having treatments. And so, you're looking around and you're going, okay, well, this is not where I want to be. Do all the blood work, do all those things, and then you show up for your follow-up. And so the doc says, so you have some abnormal proteins going on in your urine, and also we're finding this, and it's this thing called MGUS, monoclonal gammopathy of undetermined significance. And I'm thinking, okay, what does that truly mean? It was 2019, and I had been dealing with MGUS for a little bit. And, you're telling your friends at work, and they're kind of going, what? Yes. And, then the bone surveys that have been done, they show what could be some minor lesions, lytic lesions, osteolytic lesions in my calvum, whatever your head. and it was right up on the top of my head. And I remember that it was tender to the touch, but hey, you have no idea. You work out in the shop doing woodworking. Who knows if you hit your head doing whatever, or if you were bonked on your head by your wife while you're asleep. So, you don't think much of it. And so, my doctor, he gets this diagnosis, and he's a little concerned because that is a step forward in your prognosis and in your diagnosis. So December comes of 2019, and I remember taking my wife with me because I was concerned about this particular diagnosis. And we went in there, and the doctor tells me that I have progressed. Now, the progression percentages from MGUS to anything else is 1% a year. I've barely been a year, and I'm already progressing, so I'm already overperforming the wrong way. You don't really want to perform this way, but that's what I'm doing. And so here I was with a smoldering multiple myeloma, which is, again, asymptomatic, non-active multiple myeloma. Don't worry about it. Your chance of progression is 10% a year over 5 years. Okay, that sounds good. But the one important thing that everyone that has this particular stage diagnosis, I know you like your oncologist locally, but you need to get to a myeloma specialist. So I went through that process, did the PET scan, and so it was confirmed. She sent me a note later. It was confirmed, and so now it was watchful waiting. It was really tough, and even going to get labs done, because we decided that we would go every 6 months. So I spaced it out every 3 months. So it was 6 months local, 6 months down at MD Anderson. So every 3 months I was having labs done. Plus I'd have my diabetic labs done. So I was doing a lot of blood work. So watchful waiting means that essentially, just like the words state, you are sitting here and you're having blood work done at a regular time, and they're looking for markers. They're looking for changes. Now, the thing is, nobody will tell you what those changes are. They won't tell you what your light chains or what your ratio or anything like that. They won't tell you. I'm a smoldering with kappa light chain. High risk smoldering, that's what I have. And so we're watching kappa light chain, which is the best kind of light chain for myeloma to have. It's not lambda, which has a poor prognosis. So, all of those things are stacking good for me. But watchful waiting means that you go to doctors' offices 4 to 6 months, and I would choose to go every 6 months with my local doctor and every 6 months with MD Anderson. So watchful waiting is like having an IED strapped to your body with a maniacal doctor standing feet from you with a trigger ready to push the button. Now, obviously, I'm being hyperbolic about this, but think about what you're looking at. In those days, the potential that you would live 5 years was very strong. And if your cytogenetics came back bad and they weren't able to treat because of those things, then you're talking about some, serious concerns. So you're sitting there with all of these things weighing on you. Then you get cavalier. The stages of grief are that, first of all, you start to bargain and you're saying, well, God, The percentages are low. So you're just going to keep me going here, and I'm going to make it past my 5 years, and everything's going to be great. This isn't going to happen. And then, the reality starts to hit as your numbers increase each time. Each time. They won't tell you again what they're looking for. They just say that you're stable. But when you see your numbers increase, that's not stable to a human being. To a doctor, there is no statistical abnormality in the percentage increase because they're looking at a number that they won't tell you and is higher than what you have. So you're okay. So emotionally, it starts to drain on you. And every 3 months, you are going to the doctor, you get your labs done, and then you sit and you watch the labs come in and you see, oh, you have a low blood count, or this is low, or this is high. Type, 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 type. What does this mean? What does this mean? What does this mean? What does this mean? And so, you're doing all the things that you're not supposed to do. But I am a person who prepares because that's what I do. I'm a risk mitigator. That's how we handle projects. So to mitigate my risk, I'm going to make sure that I understand what's in front of me. So I had the cavalier attitude. Bring it on. I'll do my chemo, and I'll just do this stem cell transplant. It's going to be nothing. And then the reality starts to hit. And especially as the years progress and nothing is happening, and you go to your doctor and you say, well, why can't we do something now? I don't want to end up with back issues or broken bones or, why can't you do something now? So a local doctor says, you don't want to start now because it's a merry-go-round that you'll never get off. I was starting to experience pain. And, you tell people that you're experiencing pain, and they always will find a way to dismiss it. Gee, you're almost 60, Brad. Of course you're going to have pain. And so you're feeling really, inadequate about this because, you don't want to be the nervous Nelly, and you don't want to do all these things, especially someone who's been through cancer with my wife. She's looking at you because the doctors don't say anything. So I found myself getting more and more concerned. So we went around and prayed, and my wife prayed for me, and that was a healing thing for me, and went through, had more testing, had another bone marrow biopsy. This time I did a bone marrow biopsy without any sedation. And I know people are going, you did what? Well, I didn't want to bother my wife to come down to MD Anderson because we'd already been through once an MRI. And, they said, oh no, you're going to have somebody to drive you home. I didn't have to have anyone drive me home. They were wrong. So I wasn't going to do this again to my wife. So they put the lidocaine in me, and you go, whoa, that was uncomfortable. She says, just relax. And then she goes about doing her thing. And I felt it, felt pressure, but it wasn't painful. And then it was time to learn about cytogenetics. So I did my research looking at all of those things and those markers. And that's when my doctor in November of 22 told me that I have high risk smoldering multiple myeloma. And I expect you to be in treatment. You have a 50% chance of being in treatment in the next 2 years. And that was, it wasn't any worse than any other time. But I'm thinking, bring it on. Let's just get this thing done. because I am so tired of watchfully waiting and having stress because of it. I'd say the most important thing that you can do as a cancer patient is to live through your cancer. In 2023, I started a blog called Living Through Cancer. And through that, I also, in 21, published a fiction or historical fiction book. And so I like to write. And so I felt that writing and talking about my journey would be a helpful thing to others. So you need to find a way for an outlet. You need to find people who are going to support you. And when it seems like your mind is controlling your body, telling you that you have pain that people don't see, you need to not allow people to influence how you're feeling. Your mind can do a perfectly fine job of making you feel a certain way when you're really not. So you need to check yourself. You need to be aware of your body. There are a lot of resources, good resources, that are out there. Knowledge is power. You must have proper knowledge. Did I ever think that I could say the word immunoglobulin and understand what it means, or the proteins, or the fact of what cytogenetics are affecting my body? Never did. But anybody can research this information. And you want to do it with a partner. Maybe it's your spouse. Maybe it's one of your siblings. It's a lot of people who need to be involved in your care, not only your care team at your oncologist or your specialist office. And finally, you have to make sure that if you're in a watchful waiting or some type of a precancerous, you need to make sure, if you're at all concerned that you don't have the right diagnosis, get to a specialist. Your local oncologist is a great resource, but sometimes, especially with something that is as rare and blood cancer is, you need to have somebody that researches it and find your place and make peace with the fact that this is something that is treatable. Most cancers today are treatable. They're not a death sentence. There are only a few that we won't mention, but they're treatable and you can have a quality of life. But living through this diagnosis and the treatment that follows is how you get out the other side, and how you can also be part of the patient story.